So we are going to take a minute. I just want you to introduce yourself.
Okay.
Yeah.
My name is Kristi, and I have a almost 2-year-old little boy. Been married for almost 3 years, and I've been a pediatric nurse now for 10 years, and that's why we started talking about this, is because I was still susceptible to postpartum depression and anxiety. But so I've been a pediatric nurse for 10 years. Before that, I was a medical assistant at a pediatrician's clinic for 7. And then I also worked on a postpartum unit before I was a nurse. So I was a medical assistant at that time. But I feel like even with all that experience, it still didn't change my course, didn't change my path with, after birth being stressed and anxious and all that. But to rewind a little bit, I have the cutest little almost 2-year-old boy that his name is Nolan. I guess I should say that. So he's my joy right now, but at the beginning it was hard. I didn't, and we'll get into this too in a little bit, but I didn't bond with him for about a year. My husband has been very supportive, and when he sees the cues happening, which for me personally, for postpartum depression and anxiety, has always been kind of like panic attacks or anger. And so when he sees even now those cues building, he's been very supportive, and he'll get me to step away. But yeah, that's kind of my path in a nutshell.
And I think one of the most valuable things, and I loved talking to you about this, just to give people that are curious about your experience professionally. You know so much, right? I remember when we first met, you were talking about, I've changed hundreds of diapers, right? I want you to talk a little bit, to the point you're comfortable about, that kind of when that set in, when you became aware of, things don't feel quite right.
So for me personally, I had a fairly traumatic birth. And I think, after looking back now, I think that's probably maybe what led me onto the path. I don't know the data behind that, but so I was supposed to be induced on a Wednesday night. I was supposed to take like oral pills, and then I don't know what you call in the medical world, but a double bubble, so that, to open up my cervix. We did that on day 2, and then day 3, I'm still not past, I think, 7 centimeters. So then they did Pitocin. So I'm doing all these things. I'm doing everything that the doctor asked me to do. And it's day 3 at this point, and I'm still sitting in the room just waiting on my son. And then
so to clarify really quick, 3 days of labor. So you've been laboring for 3 full days.
So I was feeling the contractions, but I wasn't actually pushing.
Sure. Yes, and I think for people who have not yet had a child, that pre-labor is that very uncomfortable physical. You're in the hospital or perhaps at home, but you are having extremely intense contractions.
Yeah. So here, it's just my husband and I, because this is right after COVID. So no visitors, and I was told that I can't walk in the hallway. I can't really move around in the room because, of course, the tape kept coming off of my belly for fetal monitoring. So I just literally was laying in bed doing absolutely nothing for 3 full days. So then now I'm hearing other rooms behind me or beside me with, moms that are being admitted, and then next thing I know, I hear a baby's cry. And I'm getting frustrated, like, what is wrong with me? What am I doing wrong? And then kind of fast forward, I had an epidural that was in the wrong spot. They did the Foley catheter wrong. So everything was going wrong. And here I am thinking it's something that I did because I'm so stressed and I don't have anything else to think about. So
and all right? You've been there. You haven't been sleeping. No. It's not like you're resting. Remind just for a second for people who don't know about the double bubble. Talk to me about that.
Yes. So that is when the doctor puts in. You essentially have an inflatable balloon, one that goes on towards the top of your cervix and one below. So they insert the balloon deflated, and then they do, I believe it's 3 ounces on the first one and 3 ounces of saline on the bottom one. So essentially, your cervix is tight, and then when they inflate the balloon, it forces your cervix open.
Which is extremely painful.
I have a very high pain tolerance, but that dropped me to my knees.
Right.
And I think that was the first part where I couldn't take it. So
that's trauma, right? That was that
totally.
first traumatic, painful situation.
And then, so we did that. That didn't work because I didn't get, so I think my cervix at that point was probably 5 centimeters. Fast forward 12 hours later, then I asked for the epidural because at this point I'm 2 days in of feeling the contractions, and I begged them for an epidural. They put it in the wrong spot. So, and we talked about this, but I could feel everything on one side of my body. And I told the anesthesiologist, and they said, oh, it's because you're laying wrong. You need to shift your body weight. So, okay, I do everything that they tell me. I shift my body weight to try to level out the epidural. Still, and this is TMI, but I was having hemorrhoids.
Sure.
And I hadn't really experienced that before, but it was getting worse by the minute.
Right.
So here I am having like 10 out of 10 pain, not anymore, not because of the contractions, but now because of the hemorrhoids.
Right.
And because my epidural was wrong, I was feeling everything.
Right.
So long story short, I spoke up to the anesthesiologist again, and I said, I'm in severe pain, like something's wrong. So then they gave me a couple doses of fentanyl and said, oh, you're fine, you're fine. And then later on, I find out that the Foley catheter was in the wrong spot. It was just everything was going wrong, and here I am. I'm trying to advocate for myself. I'm trying to speak up to the anesthesiologist, to the doctor, to the nurses. Like, what am I doing wrong? I'm not getting anywhere. I think at this point, after the epidural, I was maybe at a 7, and this is day 3.
And how far do we go? I know the answer, but for people watching, how you're at a 7, what do we need to get to
10,
deliver?
Right. 10
so
centimeters,
you're
yes.
still a ways away from.
Yeah, and I believe my water hadn't broke at that time, and so I wasn't reaching the steps that most moms would reach. And you'd hear in the movies, oh yeah, this is, it happens so quick.
Your
and
water breaks and
it
you
explodes. Yeah, it's supposed to be so quick and not painless, but just, you don't expect to wait for 3 days.
Yeah, to be in pain is one thing. To be in pain for 3 days and still not getting to meet your baby.
Right.
And then at that point, and I'm not sure in our conversation if at that point there becomes stress on baby.
Absolutely. Thankfully, that didn't happen with my son, but that is absolutely a huge risk. Yes. And then they started me on Pitocin, which increases your risk for fetal stress. So then that makes me nervous. And, I'm on Pitocin for 24 hours at this point. And of course, you can't sleep. I'm on the max dose, by the way.
Right.
I should have said that. You can't sleep. You're constantly being alerted from the nurses that the fetal monitoring on your belly fell off. And so at this point, it's, I don't even know, 3.5 days in, and I'm bawling my eyes out because I'm in pain and I'm exhausted and I'm just over it. So the nurse comes in at like 12:05 on my birthday in the morning. So 12:05 on my birthday, and she sees me crying and she's like, what's wrong, what's wrong? And I told her, I was like, I can't do this anymore. I want a C-section or something. And she looks at me and says, well, you haven't even started the battle, right? You haven't even started. Excuse me?
Wow.
Yeah, so that was gut-wrenching to hear after everything that I've been through in the last 3.5 days.
Yeah.
It's now Saturday morning. It's my birthday.
Yeah.
And the first thing I hear is, you haven't even started the battle. Yeah.
Oh my gosh.
So at that point, I broke down and just begged for a C-section.
Yeah.
So I think all of that kind of led me to this path.
Absolutely.
One of many things.
And there is evidence that that's something we're kind of trying to learn about. There is evidence that traumatic labor exacerbates the postpartum depression and anxiety precursors, right? The potential of you having that. But I think too, I remember, and I am blown away by the amount of experience you've had as a nurse and supporting other women through it. I have kind of a question that I hadn't planned on asking, but I think it's important. Did any of your experiences in your job, did that ever give you pause to move forward in having children? Seeing the things that you saw.
You're gonna make me cry.
It's okay, I've cried like 10 times.
So many experiences. I know you're probably just let it out.
Let it out. Yeah.
So as a pediatric nurse, I've been all over the place in the hospitals. And most recently, I've been on the float team at our local children's hospital. And so I'd go to the NICU, cardiac units, cancer units, you know, sometimes to the ER, to the PICU, depending if they need me. The NICU was hard. You know, there was a lot of preemies. There's a lot of kids, and suck it in.
No, don't.
There's a lot of babies that you never know what condition they're going to have until they, you know, there's a lot of things that can be missed on ultrasounds, unfortunately.
Yeah.
Most of the time they're pretty accurate, but,
Yeah.
I mean, you see babies that come out and they choked on the meconium, or we call it a meconium aspirate. So they tried to come out and they were fairly healthy the whole 10 months of pregnancy. No problems at all. And then as they're being delivered, something went wrong and they choke on their meconium, and then they have to be in the NICU for 6 months. And some of these kids have to have a trach, you know, which is the airway in the throat. They have to be on a ventilator. So all these possibilities can go wrong during the birth process. And we briefly talked about it a few minutes ago about how the longer that you're in labor for, the more fetal monitoring becomes important, and it can
More
get
risk.
scary, more risk. Yeah. So I've seen many babies have a perfectly healthy pregnancy, and then it just goes south during birth. So that of course was on my mind. And then one of my best friends, directly prior to me delivering, same thing, she had a normal pregnancy, and then the baby had a stroke as she was pushing, and the baby didn't have as much blood flow to his brain, and so came out and had to be admitted to the NICU, and he survived, and he's thriving now, but the last couple of years have just been, a huge challenge. So
Extremely.
Yeah. So I've seen a lot of cases where it can just go south quick, and you just never know.
Yeah.
And that's only in the NICU.
Right.
There's so many other things, on the other units that I see, but very much it affected my decision. Like, do you really want kids? Do you not want kids?
Right.
Do you want to have that risk? So that's always on my mind too.
And
more so now.
Your experience you've dealt now with mothers during pregnancy and postpartum. How much of the postpartum mood disorders were talked about professionally inside of your staff?
So this is where it gets a little bit tricky because as a nurse on, so they have this baby, and now you're told that you have to be admitted to the NICU, and instead of all these moms thinking that they're going to get to go home and have this perfect, joyous bit of life, like right in the beginning, now they're in the NICU, and there's most of the moms are either missing, like they're not showing up to the NICU each day. They come once a week, once every 2 weeks. They don't call.
Really?
So you either have that mom, or you have a mom that is always at the bedside, just in tears. As before I had my son, the other nurses on the unit, and even myself included, the doctors, everybody, this sounds bad, but they would almost judge the mom that's not there, and assume that the mom has no desire to have a baby and they just want to walk away, and they just look negative on the mom and the family and just assume like, oh, they don't care about the baby kind of thing. Yeah. And I was guilty of that too because I didn't know any better. It's like, oh, they haven't shown up in a week. They haven't called in 2 weeks, or, whatever it is. And so you assume that they don't care. And then now looking back, it's such a light bulb moment. How did I not realize it? That those are probably the moms that are exhausted, depressed, anxious. They're breaking down mentally. They have no idea what to do.
Right.
And I never once reached out to them to ask them how they're doing, or called them, or assumed that it might have been postpartum related, like depression or anxiety related.
And like you said, you had not had experience inside of that.
clue.
You don't know what you don't know. So
Yeah.
how would you know? I think that stigma of assumption, we're all
Yeah.
guilty of it. So that's not, no one is free of their
True.
assumptions. Having said that, I do think that's a really great
Yeah.
awareness now to have, that we all cope in our own way. And what a difficult thing to be met with. You know, you've had this baby, you think you get to go home and start this life that you've been imagining. And on that note, right, how many, as pregnant moms, as pregnant women, we have all these expectations and ways that we picture things. So as I'm talking about that, you know, when you were trained in you know, nursing and your residency and all of that, or what do I call the nurse?
Nursing.
Is it nurse residency? Were you taught specifically things to look out for? What are the symptoms of postpartum? What did that look like?
So the first, there's, you know, as you know, there's multiple phases. So there's postpartum blues or baby blues, which we've talked a little bit about. And then there's postpartum depression and postpartum psychosis.
Right.
Going through nursing school, we were very knowledgeable about the symptoms. You know, we talked about it extensively. Anxiety, insomnia, like panic attacks, like I was saying before. You know, just confusion, hallucinations, like, you know, different levels of it. And back to the moments in the NICU, I was very aware, like, you know, I have the history, I have the knowledge that these moms could have been going through it, but never once did it click, because nobody else was talking about it. The moms probably didn't know what they were going through.
Right.
So you never once made the connection. And even when I was going through it, I think I was a little bit more aware of my symptoms, and I was, you know, I'm sure we'll touch on this here in a minute, but I advocated for myself because I knew exactly what was happening, and that didn't get me anywhere.
And I really want to talk about that. So that's important, mostly because so many, like you're saying, so many women that they know like something maybe doesn't feel right, but they can't identify.
Exactly.
Particularly when you're going through it, it's, I think, a lot easier to look back when you start to kind of feel more baseline. Okay, that was definitely hard. I did not feel okay. But you being a professional, knowing the signs and symptoms, how were you trying to advocate for yourself specifically?
So the first couple days of his life were hard for me because everybody says you got to breastfeed, and this, you know, social pressure says you need to breastfeed, you need to be the perfect mom, do everything right, and you know, you're going to be taking your newborn pictures, and you see these moms that have full makeup on whenever they come home, and it's like that. No, that's not me. As a nurse, I would always tell patients fed is best.
Yes.
Always fed is best. But for some reason, day one when I took my son home, that information went out the window. And I told myself breast is best, breast is best. And the whole fed is best saying just, it was gone. So the first 3 days of his life, I was trying to breastfeed because that's what I thought I was supposed to do, and that's what everybody says you're supposed to do. I didn't know what the hell I was doing. I teach moms in the NICU how to breastfeed and to do the football hold, and this is how you latch, and I'm very knowledgeable from the outside perspective, but when it comes to me, I didn't know what I was doing. So then finally, day 3, we go to the pediatrician's office, and the MA that took us in and did his vital signs immediately said, oh, he's starving, like used those words, oh, he's starving, you need to give him formula. And I'm in the corner as she's getting his vitals, and I just broke down again because here I am thinking I did my best, and he's bright yellow, which is a sign of jaundice. He is screaming his head off, and he's lost, I think, 12% of his body weight at that point. And in the medical world, you want to lose under 10%.
Right.
So he was in the at-risk category, in the concerning category. So
But there's always a loss of weight there, you know.
Always.
So that recognition of, hey, it's a little more than we'd like, but it's very normal for a baby to drop weight right after birth, and you know.
Yeah, but when you're in the moment,
Right.
I'm telling you, all of my knowledge as a nurse, like I have changed thousands of diapers. I have helped moms breastfeed. I've been on that side of the world. And now as a mom, I'm clueless. I don't even know how to change his diaper. I don't know how to hold a baby all of a sudden. It just went out the window. So he ended up having jaundice and needing a Billy blanket, which I was able to take home. The part that I think clicked, that something I knew was really wrong, is when we were at home, I was holding him in the Billy blanket, and I took a picture, and I need to find this picture to send it to you, because I looked at him and I thought I was a full failure. Like, I thought it was my fault that I couldn't breastfeed. I didn't even know, like, how much formula am I supposed to give you? And jaundice is very important to, you want to get out as much urine and as much stool as you can, which means you need to feed them as much, so that way they can break the bilirubin level down and decrease the jaundice. So here I am thinking that I completely failed him, and it's nobody else around me that, as much as they say, it's not your fault, it's not your fault, sometimes this just happens, and apparently it's more prevalent in Colorado, which I didn't know. All of that information didn't matter, and it could be my most cherished loved ones that would have said that, and I fully thought that I was not doing something right, and I was failing. And then I remember, I think at this point it's day 8 or 9, and he's screaming his head off, probably because he was hungry or his diaper was wet. And I specifically remember putting him on the changing table and just losing it. And I told you this before, and it's one of my most guilty moments. I've never even told my husband this, but he's on the changing table, and so you have this changing pad. He's screaming his head off, and I snapped and I grabbed the changing pad and I went like this, like, stop crying, and I start hitting the changing pad that he's on, and I saw his body kind of jiggle a little bit. So I didn't shake him, but I just was so full of anger that he was crying that I jiggled the changing pad. And I know that doesn't probably seem like much to some people, but that woke me up instantly, and I realized, like, that if I would have moved 2 inches closer to him, I would have shook him, or, you know.
And you know, when we talked about this, we connected over this symptom of postpartum being overstimulation and rage.
Oh, yeah.
Rage was for me, and I am about the least rageful person ever, except for once I had children. My ability to shoot into deep anger, rage, impatience, my fuse just got so short. The father that I interviewed earlier touched on a very similar story, because this is such a common symptom of our anxiety. And I think, unfortunately, we tend to, what is wrong with me? What is broken? Like, did I make a mistake? I hate to say that is the thought that we all, in this realm of postpartum anxiety, postpartum depression, overstimulation, I've made a mistake. Can I do this? Am I capable of doing this? And those thoughts, while perfectly normal, completely handicap our ability to move forward. And then you kind of sit stuck in the mud of disability almost, right? Emotional, physical, it's just this disability. I appreciate so much your willingness to share that story, because I know it's hard. I know you and I have talked about that before. But I also think it is extremely invaluable for parents to know that they're not alone in those moments of rage and fear, because a lot of the time, right, what presents as anger is actually fear.
Yeah.
And we want to do the best job possible. And how long can you go feeling like I'm failing before you feel anger? Yeah. And usually it's towards ourselves. So I know I can't take away that difficult moment, but I appreciate you sharing it. And it's just paramount that we all start to be more honest about the difficult parts of parenthood, particularly in the beginning. I've never been more uncomfortable than when I was in postpartum. Yeah. And being a professional, am I correct in you're holding yourself to an even higher standard.
Oh, absolutely.
Than the average parent.
100%. Everybody
Right.
just assumed it was going to be perfect for me because of my experience.
Right, and you did too.
Yeah, and I did too. You're
Yeah.
absolutely right. So then here I am putting all that pressure on my shoulders,
Yeah.
and my family is too. My husband, my mom,
Yeah.
who's my biggest support, thinks, oh yeah, you've got this. It's going to be fine. And then here I am more alone, because if I open up and tell my husband this story, which I still haven't almost 2 years later, which is something that I'm sure I'll have to talk to him about. But
And you know he'll love you
I know.
forever and ever anyway, right?
But
There's never judgment from the ones that
I
love
know.
us, and he's been right there.
he has, and I will never, I don't know, there's just a part of me that, especially with all that extra weight on my shoulders,
Yeah.
if I open up and tell somebody that story about how no matter how much experience I have, I still broke down and lost it.
Mm-hmm.
Are they going to look at me in shame, or are they going to judge me because I couldn't handle it? So that's still to this day, I haven't told them that, because
Because it's scary.
yeah,
It's scary.
scary.
I have to tell you, and I don't remember if we talked about this, because I feel like this was an epiphany I had in writing, some of this beforehand, but Brene Brown talks about shame. She defines shame. And how many people, I'm sorry, but I've never had anyone describe shame to me in a way that felt indicative of my experience until she said, shame is like you're in a room full of all the people who love you the most in the world, and you walk out of that room and you immediately hear everyone talking about you and saying the most horrible things.
Yeah.
And you don't think you can ever walk back into that room. For me, postpartum was like that room, I'm stuck in there. I'm in that room, and no one else is actually in there but me. I'm the one saying it. I'm the one saying the worst things about me, and I can't escape.
No.
And you just have to sort of live in that room until it lifts.
That's a really good analogy.
It really helped
Yeah.
me kind of grip onto like, why is this? What is it about this? What is it that I'm struggling with? Which brings me to the community aspect. So one of the things we're working on, right, with Afterbirth, you, me, everyone involved, is educating the prenatal mother. Okay, heads up, right? This is something that, in my opinion, isn't maybe going to happen, but it will happen to you. You will have difficult moments. You will have anxiety. You will have self-questioning depths that you've never reached before. But if we have a community to support you and remind you that it's okay. It's okay to forget for a second how to hold the baby. They are squirmy little worms, and sometimes it doesn't work and you have to try new things.
Yeah.
To have those people that you can reach out to and say, I'm not okay, and have them say to you, it's okay that you're not okay.
Well, that's the first part, is you got to find the community,
Exactly.
which is the hard part.
Right.
And so we talked about a little bit of the experience in the NICU,
Yeah.
and in regards to the community, so as a nurse, and I know we got a little off track, but
Oh no, we're good.
As-
We're on the way.
so if I spoke up to a doctor and I said, I think that mom might be struggling, I think we need to have somebody talk to her, that excludes me from being the person to talk to her. The doctor doesn't talk to her. All the doctor does is get in the chart and write a social worker order. So then now we have all these people that are stepping back and say, oh, the social worker will just come take care of it. So then the social worker walks in, usually a couple days later. It's usually not right away because they're busy.
Right.
So then now this mom is waiting a couple days even more through the struggle. So all the social worker does is talk to them for maybe an hour and just hand emergent resources like 911 for if
Phone
you're having
numbers.
phone numbers.
Right.
So then here this mom breaks down her whole story. She cries to the social worker, and all the social worker usually does is give resources on where to go. So then she didn't help provide a community for the mom. She just gave more phone numbers for her to open up and go through the whole spiel again.
So it's on mom, right?
It's on completely on
It's
mom.
on mom
Yep.
to take action when
Yep.
mom already has a new baby to care for.
Oh yeah,
And a house to care for.
Yes.
And potentially a job to return to.
and other siblings perhaps to
Right.
care for at home too. Yeah,
And 9 times out of 10, what do you think mom is going to do with that information?
trash.
Right.
So that's, and we didn't quite talk about this yet, but that's the exact reason why I didn't go through all the connections that the social worker had. I have them in my hospital system. I could easily pull up and be like, oh, this is this number, this is that website. And even one of our mutual contacts, Sarah, gave me information. Haven't done anything with it. And it's hard because you have to open yourself up and explain the story over and over and over again. And so that is not, I feel like it's not as helpful to most moms. Some people it is.
Right.
The community aspect of finding friends or Facebook groups or somebody else to connect with.
Yeah.
That's not necessarily a professional environment or
Psychiatrist or a doctor, right?
What for me helped the most is finding a community and a couple moms that just were happy being in leggings and no makeup and hairs and buns, and you just look a hot mess. And who knows if I showered for the last 3 days? Did I brush my teeth today? I don't know.
So one of the questions I wanted to ask you specifically, because you are in the thick of labor and delivery. I mean, of all the people I'm talking to, you really have and have had for years now an insight into fresh baby, fresh mommy experiences. Do you feel like postpartum depression, anxiety, mood disorders overall are a recognized condition in your specific field of medicine?
So that's a tricky answer because yes, people recognize it. Do they talk about it? Do they do anything about it? No, absolutely not. Which is hard, So like I said before, we were taught in nursing school and just in practice too, like these are the symptoms, these are what you look out for. So then as a nurse, I'm recognizing these symptoms in a mom.
Right.
So say prior to me having my son, I see that, all I would do is say to the doctor, oh, I think there might be something a little bit off. And the doctor usually doesn't go talk to the mom. It's all behind the scenes on the computer. Now, after having my son, it's completely different. Like if I see a mom crying or silent and withdrawn, because that's a big symptom, I will absolutely speak up, and I will probably hold her hand for 45 minutes while there's alarms dinging in the background, but I don't care because that's not my priority.
Right.
And so what we know in the medical world is the first 5 years of a child's life is the most crucial for brain development. And so there's a lot of data that shows in the beginning when a mom and a baby don't have that bonding moment, and that, like, say there's a mood disorder or something is wrong, no matter what it is, the anxiety, depression, there's studies out there that show that can hinder their brain development later on. And that's terrifying because it's like, here you could set your child up for success, or you could do one thing wrong and then mess them up for life. So it's scary, which also makes it worse. But
that idea, right, of imprinting, oh gosh, what am I
Yes.
imprinting, and is it healthy? When you were going through it, and this was something I don't want to miss asking you, so I'm jumping ahead a little bit, but we sat and talked for a really long time, and I absolutely loved it, about how your postpartum experience made you feel about having another child. I know this is a heavy one.
Yes, well, I'm still struggling with it, and you're the one that really helped me decide this. So I didn't say this before, but on day 9, so one day after I shook the bed or the changing table, I went to the OB's office and I said, something's really wrong, I need help. And I recognized my symptoms immediately, and I said, I need help. And she said, well, you're only day 9. I can't diagnose you as postpartum depression until day 10. And so here I am, 1 day away, and she did nothing. And so I go home feeling completely alone. And so I spend several months just in the thick of it. And even now, she fast forward to almost 2 years, she put me on medications, and I still feel like I'm out of the fog, but I still have so much anxiety. The second that he starts crying, I can feel that shift go up. And then a lot of times my husband will have to walk in, and I mean, I just said this earlier, but he'll have to walk in and pull Nolan away, or like give me a moment.
We
give
call
5
it tapping
minutes.
out.
Oh yeah,
I tap
need to
out.
tap out.
I need to tap out.
Yes. So 2 years in, I have to tap out a lot more than I thought I would. So we have talked a lot about having another kid, and it's such a hard decision because I do not want to go through the last 2 years of this mental anguish that I felt. And there's data that suggests if you had postpartum depression or anxiety for the first pregnancy, you're at higher risk to get it again, which terrifies me. And in my mind, I'm not ready for that. And I feel like that'll set me up for failure if I go into it with that mindset. But then you and I talked for hours. Gosh, and I don't even know what exactly you said, but it just clicked. And like, even if you do have it, you have a support system. It's not always the same. And I know with your second pregnancy and second birth, it was a lot smoother than the
I knew
first.
what was happening, and I think that's what was such a game changer for me, is I didn't think I'm crazy. I thought I have a chemical imbalance. My hormones are not where they should be. It's not my fault. And that alone, that freeing of I am not doing this on purpose, was what saved me from not having my second child, which I was very close to not having another one.
Make me cry. Well, so we've decided just as of a week ago to try to start having another one. I'm not pregnant yet.
Congratulations.
Thank you. But it was all because of you, because this whole last 2 years, I do not want to go through that again.
Sure.
And I've told my husband that.
Yeah.
But then after talking to you, it's like, oh, we can. I could see a therapist
And I
during
know
the pregnancy.
You want that.
Yeah.
I could tell when we talked that you want that so much. And our challenges should not define our life choices.
Right.
So I am really happy for you guys. And I know it's really scary, but I also believe that if we have the right tools and we want something, that we should not let our fear stop us.
Yeah.
And I'm very excited about that.
You'll be the first one to know.
Oh my goodness.
3 in the morning, I'll text you.
Bring it. I'm awake anyway. I don't sleep ever. But I will say I appreciate your time and your willingness and your vulnerability above all else. This is not an easy thing to talk about. And you are an amazing mother. And I know,
thank you.
I also know that your community, Sarah, who we interviewed earlier for this project, yes,
she's amazing.
She was a part of this as well. You are all in my corner, showing me that there is a community here that wants to change the way things are done, and I know that we can do it.
I have no doubt.
Yeah,
that's why I'm here, and using that support, I want to have another one because of that.
I'm so glad.
Yay,
I'm so happy.
you.
Congratulations.
Thank you.
And as usual, I am here to babysit.
I will take you up on that. 100%. Please.
Thank you, Kristi.
Yeah, absolutely. Thank you. Yeah.
You were amazing. I appreciate you so much.
You.
And I want you to take a minute and feel proud of the sharing, because it is really difficult. Thank you so much.
Yeah, absolutely.